I'm going to show pad positioning for the cervical collar. And if he's going to be laying face down on the table, I like to put the neck pad on first. You'll want the cord to be unobstructed, and so that will face the posterior of the body. His neck, it fits on the last level. You want them to be able to breathe, but also have it be tight enough so that the light is covering. If you need to expand that, use one of these connector cables and just expand here as necessary. So depending on the size of the neck, if there's a certain location, usually we like to treat definitely on the back of the neck, but if for some reason you wanted to reach and this area wasn't in the area you want to treat it, you can adjust it. But if they're going to be laying face down, then you'll want the cord either to be at the side or the back rather than the front. If it's in the front, they're going to lay on the cord, it'll mess up your pad. So we're going to use, because it does fit him, I don't need the extra attachment, barely. It's, there we go, and then I'll have him lay down, face down. Now he's got his cervical collar on, and I can do a treatment directly down the spine. So you could do this way. Also, this one's really good if somebody has radiating pain down their arm and you are aware that it's coming from their neck, then you can do this and have the cervical collar on, and say it's coming down his right arm into the elbow. You can have the pad, the back of the traps here, and into the deltoid and into the brachial region here. And so that way you have your pads where they are, where the person is feeling pain and radiating down, following that nerve route. And you can even, if you'd like, you can even place the pads, lift your the armpit up, excuse me. So you can also have them go from underneath and have your cords up, and so that way you're getting to the nerve underneath the arm, and so that the patient can then have the pads underneath the armpit and underneath that shoulder joint. The nerve is going and down into the arm. So there's multiple ways that you can do this. It's just about finding the right pad positioning, going over the affected area where there's inflammation, and turning it on. There we go. This is also a common way to treat it. And if it's just arm pain in general, tendonitis, something in the elbow, wrist pain, have your cords facing out, and I can wrap my arm here. And then I can wrap it and secure it with pads. So there's a lot of flexibility in what you can treat with this device. Basically, the main rule of thumb is to cover the area that you would like to work on and pick the right program. So